right amount of sarcasm. We are pulling back the curtain on the industry. We're talking to the experts, the educators, and the innovators. We're talking to the everyday clinicians who are out there doing all the work. There's no fluff, there's no filter, and there's definitely no sales pitches disguised as education. If it's happening in dentistry, from clinical insights to regulatory curveballs, or maybe it's the latest scandal at the ADA, we are probably already talking about it. And yes, we are bringing the goods. It doesn't matter if you're a seasoned doc or anyone in the dental industry for that matter. Maybe you're a curious consumer, or maybe you're just here for the banter. We welcome you all to the show, because around here, we're not just in the loop, we are in the know. Hey there, Dinks. I'm Dr. Jeff Horowitz, and tonight I am with Dr. Jennifer Bell. Together, we are missing Dr. Chad Duplantis, but his son, Austin Duplantis, is our producer. So he's
Wait,
kind of
can
here.
you say the famous line from Office Space? I wouldn't really say I'm missing it, Bob.
Exactly. Anyway, we created this humble platform to make the dental world just a little bit smaller, but a whole lot more fun. And I am really excited about tonight's guest. Kyle Stanley is Dr. Kyle Stanley is a very, very well-known name in dentistry for many of the things that he's done, co-founding Pearl, his work in mental illness in the profession. And certainly he is a great educator and a great clinician. He's lectured on, I believe, 6 continents already at this point. And so we're really excited to have him. We're going to be talking about everything from mental health to AI, and then even talking about some of the conversation that we had that led into us inviting him to the show, which is setting expectations with patients in a better way. So we're so proud to have Kyle. And for the rest of you, cheers, welcome. Jennifer is fresh off of a cruise. She looks rested.
Do I look tan?
Not so much. Maybe it's the lighting. But
Maybe.
yeah, somehow I look more tan than you, which we know cannot be
It's
the
not
case.
true. There's no way that's true.
So you were doing a lot of texting, and I know you were doing a lot of work behind the scenes while you were on vacation. Yeah. But did you get some good vacation? I know you were with the kids.
I actually did. While I was texting a little bit, cruise ships are still this weird isolation space, full disclosure, I've never been on a cruise before. In fact, I've always been a little bit anxious about going on a cruise for a couple of reasons. One, my husband gets seasick, so that was like top of the list. Could totally ruin a vacation.
Yeah, that great first choice.
Yeah. Two, I don't know, the confinement. We do really cool vacations. We're very adventurous as a family, so we've had some really cool times exploring lots of different countries and places and stuff. And so a cruise felt a little bit different. And so I wasn't sure if we would have fun, if it would be enjoyable, whatever. We actually had a great time. We did Royal Caribbean, icon of the seas, the biggest ship in the world, which we can do a whole show about because it was so fun. But I was really disconnected. Like, it cost so much money to get on the internet, and then I didn't have cell service for a long time, and I actually had to restart my phone today for some group texts because I wasn't included anymore. I couldn't get group texts from certain people.
Yeah.
Samsung users, you know who you are.
Exactly.
So I was forced actually to be disconnected. I didn't really have much of a choice. So yes, I did disconnect. I got a little sunshine, a little R&R, a little vodka and soda, a little
Nice.
dueling pianos, a little karaoke. Like, it was great.
It's funny. So I tend to prefer like the smaller, more intimate cruise ships, but
Sure.
with like, especially when you're going whole family, you want as many activities on there as possible.
Absolutely.
And so I know you just had a blast. But as far as a vacation goes, I find it's just easy, right? Because there's something for everybody to do. You want to check out, go up to the way upper deck, go to the spa. There's everyone can find something to do.
Yeah.
And what I really like is you know what? I'm not feeling too tired. I'm just gonna stroll down and listen to whoever's playing in the lounge or whatever.
Like a
And
little bit of Nashville. You can
yeah,
literally go anywhere and hear live
without having to
music.
leave your hotel,
Yeah.
like it's
Yeah.
just all there. So
Yeah. And you don't have to drive yourself home. You don't have to worry
exactly,
about an Uber or a DD.
that's a
Um,
bonus.
I think that's a great point, and maybe this is just for the mamas out there, and maybe there's some dads out there that are plagued with this as well, but, we do a lot of really interesting vacations, and they're often very complex with lots of moving parts because we wanna see a lot of different things, and for me, as the mom who plans a good amount of that stuff, this was an autoplay, which I told Brian after we got off the ship, I said, we need at least one of these a year
Yeah,
because this was
yeah.
actually a decompression for me. I didn't
It,
have to
it's
worry
just
about
easy.
because even when we go to the beach, if we do like a VRBO, still probably cooking a good number of the nights. I'm ordering the food, making sure we have food in the house. I'm, doing laundry. I'm still doing stuff that are part of my normal activities. So being on the cruise and people were making sure I was fed at 6:45 every day. Like, I mean, like, there was some value proposition there for
Yeah.
me.
Yeah, it is it's easy, and I agree with you because I'm also that person that wants to make sure everyone is entertained at all times.
Yeah,
So, you're always in the back of your mind going, "Oh, should we do this? Should we do that? Should we do this?" And, it's just nice to let someone else worry about you for a change, right?
I agree. And my
Yeah.
take home message would be take the trip because
Yeah.
too many of us won't take time away from our office. And I think our colleague tonight will talk a lot about the mental health challenges that we currently have with our dental colleagues. And uh, it is really important to step away from the office. And honestly, it's really important to let it run without you and uh, get a little bit of mental separation. I mean, it'll be waiting for you and waiting for you fast and furious when you show
Yeah,
back up. I
exactly.
promise you it will be.
Exactly. You'll have
Um,
payback when you get back, but it's
that's
worth
right.
it. Well, way to tie it back to dentistry because everyone out there is wondering why we're talking about cruises on.
Oh, we didn't tell
um,
you this show was
but
sponsored
yeah,
by
this
Royal
right,
Caribbean?
right,
No?
and we're going to be selling timeshares at the end of the show. But anyway, Jennifer, we got an incredible guest, so
I'm
let's
excited.
do some
You wanna do
news,
some news?
bring it back to dentistry, and then let's get Kyle Stanley on.
It's it's been a little bit of a weird week with the dental news. Uh, we're going to talk a little bit about patient outcomes because I think that's really important. There were two different dental cases that came up this week. One made national news, and kept digging into this story a little bit deeper, trying to understand because actually it hit home a little bit. You can interpret that as you will. But so a dad in Texas went in for routine dental treatment. Take that as you will for those of us in the dental profession. And within 24 to 48 hours, he ended up with sepsis and also with flesh eating bacteria. So he ended up in the hospital. And at the end, he lost several limbs um, due to this kind of infectious state that started to happen. So he went into the dental office. He had something done. I'm going to assume full mouth probing, maybe a full mouth debridement. His his wife even made note that he went in with inflamed gums and then came home with super bleedy gums. And then it sort of escalated into a big sepsis issue. I have no comment about whether the dentist did the right thing or the wrong thing. And I don't have much comment about the patient either, except to say this, because again, this hits home. A lot of patients are very sick when they come into our office, and they're often very sick without us even really knowing it. They may say something subtle about something hurts or I've been having an issue with something, and it may not really register at the time. But when a body is really fighting an inflammatory and infectious process, and periodontal disease is one of the nastiest ones out there, and we go in with all good intention, all really good intention of trying to help alleviate some of that insult, sometimes we've hit the tipping point for the body. So I don't know what's going to come from this particular situation. I fully expect that this dentists will probably end up in litigation and have to deal with this. But I want to learn something from this. We can't have individuals have adverse outcomes that happen from dentistry and routine care or an attempt to provide good care. We have an adverse outcome and we don't learn something from it because there is a pathology issue, there's an infectious issue, and an inflammatory issue. And I'm definitely not blaming the dentist for this particular scenario. I know very little about the clinical environment in which this patient and dentist interacted together. But if we don't learn something, and I only say this because I experienced something somewhat similar with a patient who had low-lying infection when they came in, and it turned into something a lot worse once they left. What was the overlying clinical condition the patient presented with? Rampant perio. Rampant perio, which really required full mouth extraction, and that patient didn't want to pursue that treatment. So it escalated into a situation that was really unhealthy for the patient. I don't think our office did anything wrong. I don't think our clinic did anything wrong. I think it was just poorly timed interactions between the intention of good dentistry and a body that was really fighting. So we have to learn something from this because I feel for this young man. I feel for the adverse outcome that came from this. I really do. And if there's an opportunity for education and improvement in our protocols on how we screen patients through the periodontal process, we have to learn from that. A few other stories of note for this week. I feel really vindicated with this story. And I know this is going to sound very strange, but there was an individual who died in Florida recently during a full mouth extraction and implant case. And we dentists get thrown under the bus pretty routinely for these particular cases because maybe it was poor general anesthesia, poor conscious sedation, poor health history intake, whatever it might happen to be. But this particular individual loaded up on a bunch of medications before he came in. Maybe or maybe not. The coroner determined he did not disclose the level of medications that he had taken before he came in. And then between that and the mixing of bupivacaine, he had a major cardiac event. Now, the coroner said no fault of the dentist, which how often do I actually get to read that story to say that the dentist isn't going to be charged for this particular adverse outcome? Again, I don't know how to prevent this. If people are loading up on stuff before they come in, taking cocaine, doing a bunch of other things that are really bad for their heart, and then you give them a little bit of epinephrine, we know the adverse outcomes could be there. I'll keep you posted if I have a takeaway message from this particular story. I honestly am just talking about it because I feel a little bit vindicated because I've told you every week I read the news and it's like some decision that a dentist made that maybe wasn't so great, or, it was a combination of events that led to an adverse outcome that's not going to work out well for the dentist. In this particular case, the dentist has actually been vindicated, which we have to take note. Now, in honor of our particular guest who's here with us tonight, Dr. Stanley, Pearl made the news this week, and I think that's pretty awesome that the company continues to grow and innovate, releasing their clinical documentation platform. I'm pretty excited about this new addition to the Pearl suite of services. They've been doing, as you know, AI radiology interpretation for quite some time. They've started dabbling in insurance verification and AI interpretation of that particular area. And now we're moving into clinical documentation, which I'm really excited about. There's not been a ton of competition in that particular space. So it's nice to see another player or two come online for clinical documentation. This is a juggernaut, and an actual email clinical conversation that we had just today on how we're going to manage the growing requirements of documentation that insurance carriers are requiring of doctors and assistants and hygienists in order to get claims paid. So I'm pretty excited about it. This was released actually just today in a news release. So as Pearl is a sponsor of the show, we hope to get a lot more information coming out in the coming days. We'll be sure to share that with you, especially for our existing Pearl customers. And maybe we can squeeze out a dinky deal for our regulars. And with that, that's the news.
Hey, Jennifer.
Yeah.
So great segment, because I was actually involved in a conversation with someone today as well about all of the burdens being put on us and what we have to provide for the insurance companies just to be able to substantiate our claims, and
Right.
that's actually starting to change how we're doing things clinically, which is pretty darn sad. We have to make operational changes and systems
Yep.
changes just to accommodate the insurance companies, which is kind of crazy. But I got to tell you this. This is what I really want to tell you. So I get a text while you're doing the news from none other than Dr. Jim Richard. And it's a video segment of a body cam that in a raid on a New Jersey dentist, not a dentist, botching a root canal. He actually has the body cam footage of this, and it goes into this whole thing. And this dentist is practicing in my old hometown of Old Bridge, New Jersey. So that this crap is following me. I feel like someone is trying to get me in trouble.
Yeah.
But anyway, I've got maybe we use this next week.
Well, I kind of
So
like a body cam. I think that could
yeah,
be cool.
yeah, kind of cool. Anyway, I just
Was
thought you'd
it
be
an
excited about
undercover
that.
operation?
It was an
Oh.
undercover operation
Wait,
because
someone had to subject themselves to a
no,
crappy
I
root
think they
canal?
went in after the botched root canal, but
Are you
you
sure?
know it's a good dentist when they're advertising to a WhatsApp group for $1,000 root canals. Oh, that's my
That's great.
gal.
That's perfect. I'll take 2, please.
Yeah, yeah. Let me save a grand on my root canal by going to someone who's advertising on WhatsApp.
Yeah, perfect. All right, you gonna introduce our guest or what?
Yes, I
Are you
am, because he's
ready?
been waiting in the wings, and I am really excited to bring this brilliant young doctor on. His name is Dr. Kyle Stanley, and he is a globally recognized leader in modern dentistry. He was named amongst the next generation of cosmetic dentistry by the AACD. He's one of the top 10 educators in dentistry, as said by the Seattle Study Club. He's listed among the world's top 100 doctors in dentistry. He's a graduate of the other USC, the one on that side of the country. We all know the real USC is the University of South Carolina, but we'll let him get away with that for now. Dr. Stanley advanced his training in dental implants in Brazil. He's been published extensively on aesthetics, implants, mental health, and plastic surgery. He's also a pioneer in artificial intelligence. And incredibly, even having a partner like Pearl, I had no idea that this gentleman is one of the co founders of Pearl and bringing artificial intelligence to dentistry. So we're going to hear a lot about the thought process behind that and what made him create a dental AI company that's now valued at over $400 million. He's helped to reshape patient care and diagnostic accuracy. But I think this is really important as well. He has also developed something called the Light Side Academy, which helps dentists prevent burnout and keep sustainable careers and build sustainable careers. He has spoken everywhere. He's spoken on 6 continents now. He inspires audiences with a very forward-thinking approach to dentistry. And Kyle, I couldn't be more excited to have you on. So welcome to the show.
Thank you very much. Thanks for having me.
Yeah, you're very welcome. And the first thing that made me want to get you on the show was, I had seen your name pop up a couple of times in social media feeds, and the thing that really popped out is like, this guy is saying what's needed to be said for a long time, which is, dentists, we don't need to be giving all this dentistry away. We need to be setting proper expectations for our patients. And you had a couple of really great posts that I thought hit home beautifully. And so I was like, I got to get you on the show. So I appreciate you coming on, but I want to hit on all these things. And maybe if you would, just to kind of get our audience, who I'm sure already knows your name, maybe let them know you a little bit better, is just talk briefly about your journey in dentistry. And you
Yeah.
know, you've taken a lot of different paths than most dentists. So
Yes.
let's hear what's behind that.
Yeah. So I'm Kyle. I'm from Southern California, and I've had my hand in many different areas of dentistry. I feel like I have a comprehensive global vision of what's happening in dentistry because I've studied dentistry on 3 continents. So in Germany, in the US, and in Brazil. I'm the clinical director of the second largest lab on the West Coast. So I've had my hands in the clinic, in the dental technician side. I do have a practice in Beverly Hills. I was a university professor for 9 years at USC, and then speaking, doing research for the last 16 years, and then starting Pearl, and now advising, investing, and really involved in the startup world of dentistry now. So I've had my hands in so many different areas that I feel like I have a unique vision of where it's coming from, where it's going, what's happening, what's exciting. And so I hope that I can share that today.
Amazing. So what did you come out of dental school, right? What's the first thing you want to tackle? What is the first
Well, I
thing?
went and did a perio-pros residency in Brazil. So
Okay.
in Brazil, they have something called an implant specialty, but it really is kind of like a perio-pros residency to where you're extracting the tooth, doing the grafting, placing the implant, doing the sinus lift, restoring it, and restoring the adjacent teeth too. So I did a lot of that. I went down there because Dr. Brandemark was teaching in Brazil at the time, and so I wanted to learn from the best, and so that's why I went to Brazil, and it was really helpful. Then I came back. I was associating, teaching, doing research as well. Ended up getting my own practice about 3 years out of school, 3 years out of residency, and then yeah, just continued on with all my other shit that I'm doing.
Mhm.
It never ends, does it?
There's always more.
I do know that very well, actually. So you're in private practice, building this thing or whatever. I have to know, like, how does one start an AI company while they're practicing full-time dentistry? Like, give us a
Yeah.
little bit of that founder mode.
Yeah, it's starts off with a hygiene check. So I go to do a hygiene check on one of my patients. His name's Ophir. He's my co-founder.
Oh,
And
we've had him on the show.
Yeah,
So yeah.
yeah,
I've heard that name before.
yeah. So during a hygiene check, he says, I have this AI company. It's not involved with dentistry, but I'm really interested in exploring if there's anything in dentistry that we could help with. Is this something you would want to explore with me? And I said, yeah, sure. I don't know anything about AI, but I know a lot about dentistry. And so that was in 2015 when no one was talking about AI. So we started exploring this for multiple years. We ended up incubating this idea within his previous company. And then in 2019, we raised our own round of financing, spun it out. He stepped down as CEO of his previous company and came over as CEO for Pearl. And, I was chief clinical officer and co-founder. So between us two and then our third co-founder, yeah, we started Pearl, and it went from 0 to 400 million in 5 years.
Not to say, are you surprised, but dentists are not always the fastest at uptake of technology, right? But in fairness, I think they're faster than medicine. So I got to
Yes,
give my dental people a little
they
props on
definitely are
that.
faster than
Are
medicine.
you fast? Are you surprised how fast it grew and how quickly it's really become?
Yeah, it's grown really quickly, but when you look at the penetration is fairly low still.
Yeah.
It's less than 10% of practitioners that are using it still.
Is it
Oh,
still?
interesting.
I thought it might have jumped
Is
over
that
that.
Yeah.
between you and, we'll say, Overjet and some of the other
Yeah,
players
really
in the
everybody.
business? Interesting.
Yeah, it's still fairly low, but that happens with every technology, right? You have the early adopters, you have the general population, you have the laggers that come in late, right? I mean, we still have practitioners out there that don't have digital radiographs, right? I mean, they exist. Not that many, but they
That's true.
exist. There's a lot of people that still don't have scanners.
Yeah, Pearl's
It
not going to
will.
work super great in the dark room.
Yeah. The thing about AI is that it's mostly software, so the implementation is much easier.
Agreed.
And there's not a big CapEx at the beginning. So it's not like you're, like when we all bought scanners, my first scanner was like $65,000 or something. And I'm looking at this wall of PVS going like, how is this making sense financially? When you think about AI, it's software, you're paying a few $100 a month that it's much easier to implement, especially now when we have native integrations to where you're already using some imaging sensor. You just press AI button, put in your credit card, and now you have it.
That's right.
And there's very little training that has to do with your team. This is why you're seeing a fast uptake with this. Now, we will get to the point where everybody will be using this and it'll be so darn boring, but we're still, still
Hungry.
early in the AI world.
I'm so surprised.
Hold on really quick, Jeff. I'm just going to say
ahead.
one thing and then
Sure.
you go into the other important part is you're not trying to take something that's always been done in dentistry in an analog and turning it into digital. And actually,
Right.
like when you talk about intraoral scanners, the learning curve is so different because you're trying to take something you understand from an analog and turn it into now what you understand to be digital.
Yes.
So you would think uptake, onboarding would actually be a lot smoother because I'm not trying to unteach the one thing to teach you the new thing. I just need to teach you the new thing.
Yeah. Yeah. No, it's a good point.
Okay, go ahead. Sorry, Jeff.
No, what I was reacting to was that number, because dentists are going to have to react to these insurance companies that are demanding this information, and they are using this technology. They're using it at a higher rate than the dentists are.
Mhm.
And you certainly don't want to be behind the technology curve to the insurance company for what they're going to see versus what you're seeing. So I'm just amazed at that integration level. I really thought from last year to this year there was a bigger jump.
Yeah, I mean, it was a bigger jump. It's definitely ramping very quickly. It's growing exponentially, but it's still fairly small when you think about the actual penetration into everyday practices.
Are we allowed to say penetration on our show, JB?
Hope so.
Yeah, it's gonna get a little boop, boop when we edit it. Or we do a ticker tape and we just count the number of times. There's two ways we can approach it.
Dr. Carol Stanley talks penetration.
That's right. Or it becomes a drink your water and whatever game. Yeah, it could be any of this. Those options are so great.
So, go ahead.
Go ahead. No, you.
No, I went last. You go this time.
All right. So let's recap.
Age before beauty.
Anyway. We start with full-time practicing dentists, cosmetic dentists in Beverly Hills. Then we build an AI company. And you're not done yet. You're not satisfied. So talk a little bit to our listeners about the next kind of evolution of Kyle, and now you're involved with mental dental connection or and foundational work to help support a lot of our colleagues. And I would love to hear more about that.
Yeah, so it was February of 2018. I was coming home and it was literally a dark and stormy night. And I remember that because in California, we don't have a lot of dark and stormy nights. And so I went to the front door and went to go open the door, but the deadbolt was on. Knocked on the door. My wife opens it, holding my son at the time, who was 1. And she said, "Welcome home." And I said, "I can't do this anymore." And I wouldn't recommend saying this to your spouse without some context, because she's kind of like, "What are you talking about?
Us?
Marriage, life,
Yeah.
Kids living together. What are you talking about, Kyle?" And I was like, "Oh no, dentistry. I can't do dentistry anymore. It's too stressful. It's not worth the money. I'm stressed out all the time. I'm not sleeping well. My health is in a poor place." But what's funny is, like, on the outside, I had everything. I had, I was making a ton of money. I had this, celebrity fee-for-service practice in Beverly Hills, doing all the perio-pros work that I was trained upon by my mentors. I was publishing and speaking at all the top symposiums, but I was really miserable. I was going through litigation with a team member, litigation with a patient, my health was in a poor place, my relationships were in a poor place. And so I knew that I had to make a change, but I didn't know what it was.
Mhm.
And so because I'm a researcher, I've been, involved with clinical research for a long time. I went to PubMed and started reading about depression, anxiety, suicidality, the mental health, personal growth. And I went on this big journey where I started learning from some of the top people in all of these industries. I started studying under them, getting mentors. And so I started changing how I think about things. I started taking more days off. I started exercising more. And because I have a platform with speaking, being on stages, social media, that I started sharing this story. And people started saying, hey, that's, I went through the same thing, or I'm going through the same thing, or my business partner is, or my wife, or my husband, or, my dental student is going through the same thing. And I realized that nobody was talking about this. And so I was talking with my dad, who's been practicing for 46 years. And he said, Kyle, this has been the same shit since the 70s, but no one ever talks about it. So I made it my goal to finally bring this topic of mental health out from under the cloak of darkness and make it so that I can be the scapegoat that people start talking about. Like, hey, did you see that weird skinny guy from California talking about mental health? I'm kind of going through something similar. And then I started building things, all the things that I wanted when I was going through burnout. So I would have loved to have a CE course on mental health. So I built that. I would have loved to have masterminds where I could talk to other dentists about it and be open and honest and, cry and complain about my hygienist and whatever. And so I built that. I wanted in-person courses. So I built that. I wanted a podcast. So me and Dr. Martin Mendelsohn built that. And now we've recently started, and we're announcing this in just a few weeks, but we'll announce it here now, is we started something called the Dental Mental Health Coalition, which is a nonprofit that helps dentists that are going through these challenges and allows them to get the courses they need, the support, the professional clinician led mental health treatment that they need to get into these masterminds and groups of like-minded people. So of all the things that I've done, and I've done some pretty cool things in my career, this is by far the most rewarding.
I can definitely see why. Do you what do you attribute a lot of the mental anguish that the dentists experience now as compared to maybe say in the last generation? Because I think in the past there was a
Jeff,
lot
you are the last generation. Let's be
thank
honest.
you. I think that in the past, a lot of dentists were always seen as causing pain, and dentistry was just it was a lot different animal than it is now. I mean, we're still working in a very intimate place in people's faces, and people are still nervous. But I think the association with pain used to be much greater. Do you and possibly that's what got so many dentists upset about the job, is having everybody just hate them for that reason. But I feel like maybe now there are social media pressures, practice pressures. Yeah, what are you seeing?
Well, there's 18 different triggers that I go over, and we won't have to go over all 18 today, but one of the ones you mentioned is definitely true. I mean, we have a really bad media presence, right? Anytime you see a dentist in the media, it's either we're a bumbling buffoon, or we're trying to rip people off, or we're sexually abusing people, or we're hurting people, or children are dying in our chairs. And you never really hear about all the amazing stories that we all know happens every single day when you change someone's life and allow them to start eating again, allow them to start dating again, getting healthier. They lose weight because they're so happy about it and they can finally eat what they've been wanting to eat. Like, those things never make it into the news. It's only all the shitty stuff about us. And that creates patients that are fearful of us. And no one talks about how it is to treat patients that are fearful every day. We always talk about how is it for the patient. We talk about when we give an injection, how their blood pressure goes up. But we have research to show that our blood pressure goes up 20% every time we give an injection. And some of us give 20, 30, 40 injections a day if you're doing high volume. And no one talks about how that affects us long term. When you talk about the difference of the previous generation to now, I have an interesting experience with that because my dad's a dentist and, graduated in 1976. And he and I were just talking the other day. My brother's a
That's
dentist
before
too.
me, JB, by the way.
What's
So
that?
that is before me.
Yeah.
I'm
Okay.
just proving that to JB. Yeah.
And, my
So
dad said when he got out of practice, his entire practice of like a 5-op practice was like $200K. That's like 1.5 operatories now.
yeah.
There was no scanner, there was no digital sensors, there were no computers, there was no face scanning. There were like the technology was totally different. On top of that, he got out of school with like $2,200 in debt. I graduated with $425,000 in debt. And we know some of our dental students are coming out with $700,000,
Absolutely.
$1 million, especially if they're doing specialty. And one thing that's always been there is the fact that we have two hats that we have to wear. We have to run the business and work in the business. And there's other businesses that do that too, but not usually in healthcare. There's not a lot of healthcare professionals that run the business and do the microsurgery. One of my friends is a foot and ankle surgeon at Kaiser in California, and he's an incredible surgeon. Right now, he's the chief, so right now he actually has to do some of the like business aspect. But before that, he was like, I come in, I do my surgeries, I write my notes, and I leave. He doesn't have to think about HR, payroll, ordering, updating the software on the CBCT, right? Like none of that. Come in, do the work, and leave. And we do have the autonomy of doing that too. So it comes with good things, but there's a lot of pressure on us. And there seems to be, when you take all these little triggers that are happening and you add into the fact that there's a public taboo about talking about this, that if you're going through burnout, if you have mental health challenges, that you're just weak and that you just can't handle it and you should just work harder, that doesn't add to it. And we have a lot of research showing that we're twice as likely to suffer from depression, anxiety, panic disorder. We have some research showing that we're as high as 17 times more likely to die by suicide than a non-dentist. Not 17%, 1,700% more likely to die by suicide than a non-dentist. I've kind of become the guy that talks about suicide in our profession. And so I hear about all the stories, the ones that nobody talks about. People message me. I've now started working with some of the families because, these widows and widowers are left with a practice. They don't know how to sell. They don't know what letters to send to the patients. They don't know, they don't understand what their spouse went through. And so it's been really rewarding, but it's a really challenging profession that we're in.
And I think additionally, we've become the bad guy and the bad messenger for so many other people. Now we tell bad insurance news. We tell bad diagnostic news. The number of people that we quote unquote represent while we're sitting in a chair, and then also have to carry the water for and make excuses for whatever we want to do. That weighs on people who generally pursued a career for they're empaths. They want to take care of people. They generally like people. They have a caring heart. They want to serve. They're type A very commonly. So that like constant compression of all like I know in our practice in particular, my partner and I've had many challenging conversations about the lack of control that we have over so many parts of the business that ultimately impact our reputation in the community. Like if an insurance company doesn't pay for something, somehow it's our fault. If
right.
We have a bad employee and we have to kind of cycle through that, that's our fault. If we have an adverse outcome, that's there's just, if the lab doesn't do what we've asked them to do, that's our fault. Like we're carrying the water for so many different people. At some point you get really tired. Your shoulders get sore from being the person in front of the patient constantly going, I'm sorry. I'm sorry. I'm sorry. I'm sorry. I'm sorry.
Well, people have to blame us for things, right? I mean, it's still crazy to me that people come in with self-imposed disease and then they get mad at us for finding it.
Right.
Like, if we're honest, 90% of what we fix is completely preventable without us, right? If you don't eat
Absolutely.
shit, if you brush and floss your teeth, and maybe even if you come see us, fairly normally, you could have zero problems, like
Right.
zero.
So
So
yeah,
don't
go
come
ahead.
to
I'm
me
sorry,
with
go ahead.
decay and then complain that I find it.
Yeah. And this, what a great segue, because I want to talk about what you have been talking about a lot of late, which is letting patients own some of the responsibility.
Yeah.
For me, that day where I became confident enough to say, no, this is a problem that you came in with. This is a disease process that you own. And I'm only here to offer you the best possible solution for this problem that you already had, that I am not going to absolutely fix. I'm going to make it better for as long as I possibly can and do that the best way I can. But here are the future risks.
Yes.
And that's why I loved, what you were saying, is that there needs to be a conversation of expectations for the patients ahead, because, two patients come in, you're doing two crowns, one after the other. The first patient, you say, okay, I just want you to know, that anytime we drill enough on a tooth to do a crown preparation, there's a 7 to 8% chance it's going to need a root canal in the future, regardless of anything that we have done here, And then you forget to say that to the second patient.
Right.
And, you're the
Uh-huh.
same guy, but with the second patient, you're the guy who, the drill must have slipped, or they must have drilled too
Mhm.
deep. Or, I mean, I defend a lot of I don't personally, I'm not the attorney, but I serve as an expert witness in a lot of
Thank you
these
for doing
cases.
that, by the way.
And everything, oh, absolutely. I mean, that nothing compared to what you're doing. And I actually enjoy it. And if it's indefensible, I just say to the attorneys, look, you're going to have to settle this. I
Mm.
can't stand behind this.
Mhm.
This is bad. But I never am on the other side.
Yeah.
But regardless, it always seems to come down to communication, and communication prior to the event, not after the event.
That's
It
exactly
it
right.
Yeah, and so when I saw your posting about that, it just lit a fire in me, and I said, I got to get Kyle on, because I just want to hear more about that. It took me so long. It wasn't until I went off to John Coyce and said, wait a minute, there is a thing called risk, and
Yeah.
I am owning all the patient's risks. Why am I doing that? So what was the epiphany for you?
So after I'd gone through burnout and I had started to teach mental health and what I had been through and how I got myself out of it, I boiled it all down to three things, which is boundaries, expectations, and communication. And what's funny is when you look at those three things, none of them are clinical.
Mm-mm.
Mhm.
It's because most of us are pretty good clinically, right? Because we went to school for 8, 10, 12 years to learn how to do what we do clinically. And what so many of us dentists do is just say, I'm going to take another clinical course and that's going to solve all my problems. Oh my gosh, if I just learn ortho, that'll solve all my problems. If I just incorporate this new technology, that'll solve all my problems. Like if I just learn how to do biomedical dentistry, that'll solve all my problems. And it doesn't, because I did all that and I was pretty good clinically and it didn't help me mentally. And so when I started to look at boundaries, expectations, and communication, once I started working on those skills, my entire life changed. And one of those big ones is setting expectations with patients about what I can control, what I can't control, what I'm responsible for, what I'm not responsible for, and what they're responsible for. So I have something called the triangle of blame, which really shows that, yes, there's things I can do wrong. There's things the patient can do wrong. But even if we both do everything right, we still have things we can't control, like biology, physics, genetics, diet, all this kind of stuff. So I did a lot of implant work because I was trained in surgery. And so, I would place 100 implants and 96 of them are perfect. And 4 of them didn't even integrate, right? Now, what if those 4 people are genetically predispositioned to have implant failure? Is that my fault? No, it's not. And so I was talking with my friend who I told you about, who's a foot and ankle surgeon, and his name's Mike. And I said, Mike, if you have a failure in your case, he goes, what do you mean by a failure? And I go, I don't know, like the plate, doesn't work, and he goes, oh, you mean a revision? And I go,
Yeah.
oh, you guys don't call it failures? He goes, no, it didn't fail. Maybe it's a complication or a revision. And so I started incorporating this term revision because that's what medicine uses. So if I
Yeah.
fall and I hurt my ankle and then I go in 6 months later and I still limp a little bit or I have like some pain, they go, you know what? We need to do a revision surgery. Any of you guys think that it's free?
No.
No, right?
Mm-mm.
I'm paying for every stitch, every sponge, every minute that the light is on. I'm probably paying for the nurse. I'm paying for everything again. But in dentistry, we're like, oh, yeah, I know it's only been 7 years that you've had this crown, Mrs. Jones, and you bit
But it
on
must be
ice,
my fault.
Yeah.
but it's
Yeah.
totally my fault, right? And then, like you said, Jeff, it's like you have to say this before. The annoying part is that complications only happen like 2 to 3% of our cases,
Mhm.
but you have to say it in 100%.
That's
And so
right.
I started doing that, and I started to be very upfront with patients. Like if I place an implant, hey, this could last. You could die with this in your mouth, or it could fall out before you get to the elevator. But if that happens, you're gonna have to pay for it again. And if they were like, oh my God, that's crazy. Oh, you're no way, then they're not the right patient for me. But you have to be able to set that boundary. Remember, that's the third thing. It's boundaries, expectations, and communication. And what most people aren't comfortable doing is setting the boundary because they don't have the talking points. And I kind of learned this from training jujitsu. I trained jujitsu, and when my son first started training, he did a course called the Bully Proof program, which is like teaching young children how to stand up to bullies. And what they say is children that don't know how to defend themselves won't set the boundary. So we're not teaching our kids to fight. We're teaching them to avoid fight at all cost. But they're not going to avoid the fight and like put up the boundary and say, stop saying that to me unless they know how to fight. And so in dentistry, knowing how to fight is having the scripts, having the templates, having the talking points, having the note templates. And so that was what I created. And we've now had over almost 4,000 dentists. It's like just like 3,900 or something that have gone through this program and are now setting boundaries with patients. And so it's really cool to see.
How do
Wow.
you think, let's talk about different stages of dentists and how they process because I think Jeff hit on it a little bit. Confidence certainly helps. When you start to feel
Yeah.
more confident in your skill set and you've done enough of these procedures to sort of anticipate complications. I am definitely a different communicator today than I was 3 years out of dental school, where I
Yeah.
wasn't really sure when the burr was actually dull or not. Like
Yeah.
there were a lot of challenges that were happening on a daily basis. Talk to me a little bit about how a young new doctor might interpret that process and like what the evolution might be versus someone our age versus maybe someone Jeff's age.
Mhm.
Like anyway,
There's a lot of unknown unknowns with young doctors. I was
yeah,
definitely there. I didn't know what I didn't know. And once I learned that, it was much easier to look back and have those
yeah,
conversations. I think for me as a young doctor, and what I've seen with the people that have gone through my courses or that I've mentored, is that they're so worried about losing the case that they don't set the expectation.
yep,
And so they're really gambling with that. They're like, well, I'm not going to tell them about all the complications because then they may not do it. But those are the people that take you to court, that Jeff sees in court. Those are the people that write you a bad review, that scream at your front office. And so you really have to get to this mindset where you realize not every patient is right for your practice.
yep,
And that was a really hard thing for me. And it came out of a good place. It came out of me wanting to help everybody. I was trained by Pascal Magnier and Sasha Jovanovic and Christian Coachman. Like I had the skills to help these people. And the other dentists, the 5 other dentists that they went to, they didn't, right? And so it's like this weird ego thing. But once I learned not every patient is right for my practice, I was able to set those boundaries. I had to learn some skills. Like I had to learn scripts and talking points and how to talk to people. And once I did that, it really changed. So if I can catch doctors earlier, it's always better.
mhm,
I don't want them to go through all the shit that I went through and that other people have went through. I'd rather catch them early The problem is most people don't seek out non-clinical topics until they absolutely need to.
Yeah.
And I love that I mean, I love that you hit that point, because when I think back on all of the cases where I have served as a witness, and I can only think of two where there was actually a procedural mistake, where there was actually a clinical deficiency in the case.
Yeah.
Every other case that I have been on, it was either about poor informed consent, poor management of expectations.
Yep. Boundaries,
It
expectations, and
it was
communication.
Yeah.
all about the communication
Yeah.
of, the risks of what was being done, but could find nothing wrong with the procedure, or the clinical acumen of the doctor who performed it.
It's the
And
same thing I see in the lab.
yeah.
So I'm the clinical director of a laboratory, and they do thousands of cases a day, right? And I usually get involved when there's problems, right? When it's the second, the third remake. And what's funny is so much of those things are just communication.
Mhm.
So like the doctor's mad because the case didn't come in on time. And I talked to our team at the lab and said like, well, did you tell them that it was going to be late? And they were like, well, we were waiting on the implant company was back ordered on this component. I said, well, did you tell them that? And they said, no. And I'm like, okay, well, like you need to tell them that, right? Or like the opposite way, right? So like the doctor expects that we're going to design it a certain way, and then we don't, and he or she is then mad at that. I mean, everything just comes down to communication. Most of the time, the doctor's doing pretty good work, the lab's doing pretty good work, but it's just this lack of communication.
Will we ever be able to solve that problem? Like it's plagued. It's not just dentistry. It plagues
No, it's everything.
politics. It plagues
Yeah.
everything, really.
Yeah.
Like,
But what's cool is that when you develop, like these are skills. This is one thing I had to learn. One of my big revelations is that everything is a skill. I thought only hand skills were skills. For a dentist, that's what we think, right? Like prepping is a skill.
Yep.
Even maybe like smile design is kind of a skill, right? But communication is a skill. Setting expectations is a skill. Dismissing patients is a skill, right? And what's funny is once I learned these soft skills in my professional life, I applied them to my personal life. So I'm better at setting expectations with my wife. I'm better at setting expectations with my kids. I'm better communicating with my neighbors. And you just become a better person.
I think that is an amazing way to end, because number one, a couple really key takeaways that I want to make sure our audience notes. We pursue, as clinicians, we're really hungry for the clinical stuff, and we forget to pursue actually, honestly, probably the 60% of the other things that take up most of our time in practice.
The research shows that 85% of your financial success, just financial, is not based on your hard skills. It's based on your soft skills.
All you have to do is go into multi-doc practice and see differentiations between providers. The good communicators and the poor communicators might all be clinically sound. One's outproducing the other, and it's not because they're faster.
Mm-mm.
Simply because they can communicate and they can walk patients through the treatment planning process without selling them on dentistry, because
build trust.
Absolutely. Absolutely. So I love that. I think helping in really important for young doctors to learn how to put risk back to the patient and have them own their own disease process. And that you could be the best Kyle Stanley in the world with the fastest handpiece and all the things. But if you're putting it in a caustic environment, it probably won't be successful. And I think the minute that you start to give patients ownership of that, there's a lot of freedom mentally and emotionally for doctors to sort of allow patients to own that. And I think, if no one gets anything else out of this podcast, which would be virtually impossible, as there was so many great quote unquote pearls that came from it. But you see what I did there? Like giving patients back, having them own that so that you can be free to do the dentistry is such for me, it was a big change. It probably saved me, to your point, it probably kept me in dentistry. I probably would have been long gone by now because I took everything home.
Same.
I replayed every margin, every
Yeah.
root canal, every extraction, every interaction with the patient. I replayed it over and over again. And the minute I gave it back to the patients, I sleep a lot better.
Yeah, it's a very liberating day in practice. That's what I always say is the most liberating day is the day when you can finally say to a patient, "Listen, if this breaks, it's on you because you're not taking the steps that you need to protect it and reduce the risk factors." The
Yeah.
day you can say that and feel good about it, and I think it actually sells, and I hate to use the word sell, but I do believe that that sells more cases because I think that that confidence then moves over to the patient. They say, you know what? This guy knows his stuff, or this
Mhm.
gal knows her stuff, and they're confident and they're willing to let me walk.
Yeah.
So,
It's with or without you attitude.
yeah,
No one
yeah,
wants to be sold and be like, you have to do this, right? He's like, yeah, this is something we could do. If you want to do it, cool. If not, but if this breaks, yeah, you're gonna have to pay for it again. I've done
yeah,
thousands of these, and I'll tell you, sometimes they last the rest of your life, and sometimes they last 2 months and they break. And I can't predict that. Once you leave this practice, it's up to you and genetics.
and if you're not comfortable doing that, just get a video of Kyle doing that, and just play that to your patient.
That's the
They're like,
body
who is this
cam.
guy?
It's body cam, but inverse. You just play Kyle on your chest and you're like, excuse me while my friend Kyle tells
My
you
friend
what
would
he
like to
really
talk to you.
Yeah,
thinks.
what Kyle said.
Yeah.
Hey, would you do us a favor though? Let everyone out there know how they can get in touch with you, how they can get some of this just much needed training, because it really can be life changing. So please feel free to share that.
Yeah, so I mean, easiest place to find me is my Instagram. It's just Dr. Kyle Stanley, Dr. Kyle Stanley. My website is the same thing, Dr. Kyle Stanley. You can also go to lightsidedentistry.com, which is where I have more of my mental health stuff. We do live seminars, online stuff, live stuff. Everything is CE backed. So I think that, I worked really hard for that. We were the first CE course to be accredited that was talking about mental health, because I think dentists that have better mental health are better dentists. One of the things we're trying to do with the the Dental Mental Health Coalition, is make it a requirement for every state to have to do 1 unit of CE of mental health, just like how you do HIPAA, just like how you do all these other things. We're just asking for 1 unit a year. That's it, because we've seen how it can change people's lives. So that's how you find me.
Love it. Well, thank you for everything that you've done for dentistry. Thanks for becoming a better Kyle, because a better Kyle and sharing that with, as many other dentists are out there, it is just so valuable, and it will touch other people's lives. So it's much appreciated. Thank you for taking the time to be with us. And man, I hope we cross paths at one of the upcoming meetings.
Yeah, hope to see you guys.
Yeah, JB, you want to close us out?
I would love to. Well, thank you again, Kyle, for coming on. We really appreciate it. Guys, we have some big announcements coming soon. It's going to be pretty awesome. So stay tuned for that. Maybe there's a live event in our future. Maybe, Jeff, maybe.
Maybe. Wait for it. Wait for it.
Maybe. I think we'll be pretty close to announcing next week, so we'll send more details. But in the meantime, I think the takeaway tonight is definitely to take care of you first so you can take care of others better. And with that, have a great night.
Good night, everyone.